Hello, everyone, and welcome to today's brief synopsis lecture on the DSM-5 TR, the Diagnostic Statistical Manual of Mental Disorders, 5th edition, text revision. And whether what we're going to do is we're going to understand in this, hopefully, the essential elements of the DSM-5. But today we'll try to break down 5 key points. What the DSM-5 TR is and why it matters. Key updates from the DSM-5 to the DSM-5 TR, the structure of the manual and how to use it, and diagnostic criteria and cultural consideration, and finally the strengths, limitations, and ethical issues. Okay. The DSM-5 TR is published by the American Psychiatric Association, and it's official classification system used in the United States for diagnosing mental disorders. And best way to think is to think of it as a common language for clinicians, researchers, and policymakers. Some of the things that I want to talk about are standardized diagnosis, improve reliability between clinicians, psychiatrists and psychologists, counselors, social workers, researchers, and insurance companies are the main audience for the DSM-5 TR. And the relationship to the ICD-10 CM or the ICD-11, which just recently came out about a year or two ago. The DSM aligns with the ICD code for billing and public health tracking. Okay. So those F codes you see are all aligned. Many people assume the DSM-5 TR is just a reprint, but there are some important updates. And some of the updates I want to highlight are there's a new disorder added, and that's prolonged grief disorder, PGD, prolonged grief disorder, and it's placed under the trauma and stress related disorders. And this is for anybody who is experiencing grief for a big long period of time. Usually grief was looked at as being a couple of days, but it's like when you look at a person having grief for like years, but they don't quite fit the criteria for like depression. The classification and refined wording for several disorders is different in the DSM-5 TR. Example of that is autism spectrum disorder. And we talked a little bit about class how autism has been included as a spectrum, and a disorder like Asperger's has been eliminated and it's under the autism spectrum disorder. And then you also a reclassification of major depressive disorder. Okay. Some of the cultural and demographic revisions in the DSM-5 TR are the expanded cultural formalization interview, right? And the updated prevalence data with demographic breakdowns on how to address in your reporting different demographics. Okay. Language changes, efforts to reduce stigma and terminology, like replacing gender identity disorder in earlier versions of the DSM to gender dysphoria, right? The DSM-5 TR is organized into 3 main sections plus appendixes, okay? Section 1 is basic use. It's the introduction, how to use the DSM, definition of mental disorder. Section 2 is a diagnostic criteria and code, grouped by disorders category. So you have the neurodevelopmental disorders, the mood, the anxiety, psychotic disorders. So they're they're grouped that way. Emerging measures and models. Um, Assessment measures, cultural formalization interview, alternative models for personality disorders, and then you have the appendix. So it's a glossary of technical terms, coding updates, and revision. Excuse me. The DSM isn't a recipe book, it's a guide. Clinical judgment is the key, right? So one of the things you want to do is you want to gather in the data. So during your clinical interview, the mental status exam, the collateral info, excuse me, match symptoms to DSM criteria, rule out differential diagnosis, consider cultural, developmental, and medical factors, and use specifiers for precision, like with anxious distress and depression. Cultural considerations you want to use are the cultural formalization interview. Uh, Understand that symptoms may present differently across cultural groups and be aware of biases in applying criteria. Strengths and limitations and ethical considerations with the DSM-5-TR are standardized criteria, supports communication across professions, and facilitates research and treatment planning. Some of the limitations are risk of pathologizing normal variation, cultural bias in criteria, some disorders like strong biological markers, and influence of insurance and billing requirements. Some ethical issues is avoid overdiagnosing and medicalizing normal behavior, maintain cultural humility, and ensure diagnoses are used to guide helpful interventions, not just labels. In summary, the DSM-5-TR is a virtual tool in mental health. But like any tool, it's only as good as the skill and ethics of the clinician using it. It gives us a shared language, but not the whole story. So we must integrate it with clinical judgment, cultural awareness, and compassion. All right. So that will basically sum up our little talk on the DSM-5-TR, and we'll do more extensive work in class. Thank you.